Embedded in North Dakota's Century Code, this purpose statement identifies the work of the state's only comprehensive school of medicine and health sciences.
The primary purpose of the UND School of Medicine and Health Sciences was to provide the healthcare workforce for the state and to improve the quality of the lives of North Dakotans. We at the school completely embraced that wording and that concept, and I think we've been successful in working hand in hand with the legislature and with the communities to better the healthcare environment in the state.
Ironically, this wasn't always the school's official purpose. Founded in 1905, the school initially granted medical students a 2-year Bachelor of Science in Medicine degree. This meant that for the school's first 70 years, students graduating with a 2-year medical degree needed to transfer out of state to earn their 4-year medical doctorate. By 1970, it was clear that this arrangement was costing North Dakota its physician workforce. Many UND grads transferred out of state to continue their medical education and never returned.
What we had previously was that medical students would spend 2 or 3 years at UND, but then go elsewhere for the remainder of their education. This had a number of adverse effects, but perhaps the most important one was on physician workforce, because when physicians left the state, they were less likely to come back to the state.
When I started medical school in 1972, UND was just a 2-year medical school at that time, and we would transfer at the end of 2 years to another medical school somewhere in the country. I think the thought was that there really wasn't the capacity for the 3rd and 4th year for students to have access to patients and clinics and hospitals, thinking that North Dakota was too small to accommodate that.
Considering the problem, UND President Tom Clifford met with interim medical school dean John Venice to discuss how the school might expand its medical curriculum into a full 4-year MD program.
A lot of gratitude to somebody like Dr. Venice, who was chair of the microbiology department and I think taught a 2-credit course when I was a student, but he was the chair of the committee to get the 4-year medical school going. And, that was an enormous task to get faculty, administrators, legislators, and clinicians involved. And he did a great job.
So the team got to work, contacting the school's advocates in the North Dakota Legislative Assembly.
The issue was in 1973, are we going to go to 4 years or are we not going to have a school?
Because UND didn't, and still doesn't, own or operate its own hospital, school officials also reached out to health systems across the state, since it relied heavily on the state's clinics and hospitals to help train medical students as they began their clinical rotations. When UND could only offer the 2-year degree, this hands-on training occurred away from North Dakota.
Basically, it was surprising to me at the time that the most opposition came from physicians themselves. And there were 2 reasons why which they didn't think that North Dakota should have a 4-year medical school. One was that they didn't think we'd have enough variety in patients. And the second was that they didn't think we would have enough clinical sites and enough physicians willing to participate.
After negotiating with the legislature, local providers, and the University of Minnesota, UND hit on a temporary solution, the 2-1-1 model, where medical students spent their first 2 years in the classroom at UND, moved to Minneapolis for clinical training in year 3, and then returned to North Dakota in year 4 to complete their clinical work in the state's health facilities. Imperfect as it was, the 2-1-1 plan worked, providing a pathway to a 4-year MD program in North Dakota. Just ask Dr. Robert Argusel.
Went to Minneapolis for our 3rd year at the University of Minnesota, doing rotations with their students. I think my first one happened to be in surgery at a private hospital, and the staff was a university professor, and they had residents, and then there would be, several. Well, I think in my case, 4 students sometimes, observing surgery. The surgeon would ask, "Well, what's this anatomic structure?" And I named it, and then he said, "Well, yeah, you're from North Dakota. You're going to know all these things." So he never asked me another question, which was good. And the other 3 students, got got nailed. But yeah, I think, North Dakota medical students were well versed in anatomy. That was a strong suit here. And I think wherever they went, they stood out.
The school's first four-year graduate by virtue of his last name, Arusel spent 3 years specializing in radiation oncology at Mayo Clinic in Rochester, Minnesota, before returning to Fargo to practice for more than 30 years.
Yeah, I think being first or just part of that class. I mean, we'd gone through a lot, wondering if we would actually have a fourth-year medical school when we started. And it was a celebratory time. You wouldn't have as many physicians in the state. I mean, there's no question.
For reasons involving both program accreditation and cost, President Clifford and eventual medical school dean Tom Johnson got to work lobbying the legislature, the State Board of Higher Education, and the North Dakota Medical Association on building the 4-year MD program at UND.
Now, going to a 4-year school was the first step, but it wasn't sufficient.
With the help of Grand Forks Representative Earl Strinden, the UND team made their case. They secured support from Bismarck, area hospitals, and clinics. As a result, North Dakota's medical school became a permanent, accredited 4-year medical institution.
I think if we did not have that 4-year program, we would just be doing preparatory education for medical students who would then go elsewhere, either because of lifestyle or because of salary or because of disconnection from their families, be recruited to other states.
So I think we would be far less capable of handling the health needs of North Dakota if we had not made that move. I'm sure it was looked at as expensive. It probably was. It's been an investment, not an expense. And there's a big difference there as far as I'm concerned. So I'm very glad it was done.
Key to their success was the fact that UND agreed to distribute medical education to sites across the state in Bismarck, Fargo, Grand Forks, and Minot. Under this community-based model, for their first 2 years, medical students train on the UND campus in Grand Forks before traveling to clinical locations across the state for their 3rd and 4th years.
So having the 4 campuses gives people that sense of connection for different areas of the state.
So by splitting up to the 4 communities, the 4 larger communities, you do have a variety of patients that seems to be enough to satisfy the needs of the medical school. Plus, it also provides people in those communities with another option for healthcare.
This is the model UND's School of Medicine and Health Sciences follows to this day. Along the way, North Dakota's only medical school moved from a building centrally located on UND's campus, what is now O'Kelly Hall, to the former St. Michael's Hospital building in Grand Forks.
I liked the way it ended up. Initially, it was kind of on the old model where you had basic science, you had clinical science, and that's why I went to medical school.
This change in physical space helped trigger a change in curriculum. By the 1990s, under Dean H. David Wilson, the school adopted what it calls patient-centered learning. Students engaged with patient cases on day 1, working in small cohorts with faculty to study patient histories, differential diagnoses, and therapeutic options, while also learning the systems behind the care. This approach stood alongside the traditional didactic model of biomedical and physiological lectures. Under Wilson, UND led the nation in embedding patient cases and collaborative learning into medical education. This integrated approach is now recognized as best practice nationwide.
And this is just my memory, and it seems like we spent a lot of time in class lectures, 8 to 4, 5 days a week. We would be in some labs, looking at microscopes or specimens. So totally different than the educational process now. I think it's definitely so much better as far as tying information together, and it's mind-boggling to me the amount of information that students need to learn now.
The closing of the 20th century saw changes in the local economy that hit many rural areas hard. As North Dakota cities grew, many of its small towns continued to shrink. Amid these shifts, the state's only medical school turned its attention to interprofessional training, where medical students focused on primary care and worked alongside nurses, therapists, and other healthcare providers.
So what we discussed with the legislature were the steps to take to be able to expand the healthcare workforce, physicians, but also other professionals as well. And what we concluded was that we could expand class size and thus have more physicians for North Dakota. But when we did a study of the available facilities, we didn't have sufficient facilities for the size of the expansion that we were planning. As it turns out, we were able to expand overall class sizes by about a quarter. And for that, we simply needed more space.
Arriving in North Dakota in 2004 and assuming the role of dean in 2009, Dr. Joshua Wynn took these challenges to heart. Under Wynn's leadership, the school further expanded the MD class size, established new residency programs, and oversaw the implementation of interprofessional programs that exposed medical students to simulated hospital and clinical scenarios in their first weeks on campus. As the state's population grew and healthcare delivery changed, it became clear that the college's other programs, which were sometimes off-site, needed to be closer to the medical program. Thus began the campaign for a new, standalone building in Grand Forks that could house each of the school's healthcare programs, including physical and occupational therapy, medical lab science, and athletic training.
The legislature, again, in my view, wisely decided that the correct answer was a new facility, and that led to the new School of Medicine and Health Sciences building that permitted us not only to do innovative educational work, but more importantly, from the standpoint of what the people of North Dakota wanted from us, it enabled us to expand class size, expand programs, and thus retain more physicians and other healthcare providers for practice within the state.
In 2016, the school saw another change of scenery, moving from the former hospital into a new 325,000 square foot building on the north end of UND's campus.
The new building happened because of leaders coming together. The new dean at that time, Dean Wynn, became very supportive.
This move allowed the school to house its many programs under one roof.
They built the building, we provided the workforce, and things are better now than they would have been otherwise. That doesn't mean to say that there still are not shortages of physicians and others, particularly in rural areas, but things are better than they were and much better than they would have been had we not done the expansion that was only possible because of the new building.
The shared space streamlines student learning and, at the same time, enables more and better interprofessional education, such as hospital-based medical simulations that involve all the health professions playing a role in patient care.
When I run into someone who is now in the program, I say, oh, please stay in North Dakota, because we need you here.
The greatest gratification is chatting with physicians and other healthcare providers that we helped educate. It is such a fulfilling and a wonderful feeling. So I would say the hallmark, the high point for me is each and every time when I meet a graduate and hear about what's happened to them since they graduated from the school and how much they appreciate the experiences that they had here.
I won't be here in 50 years to be interviewed, but the School of Medicine is highly regarded now. What has really helped was the number of family physicians that are going to rural communities, because we have a number of legislators that know those doctors, whether they go see them personally or not. They know them in the community, and the School of Medicine is highly respected in the legislature.
I had the opportunity to meet the new dean, and I think Dr. Jenkins is going to be a fantastic addition to the med school. And looking at her past history, she's definitely very forward-thinking, and I think is going to be a great asset to UND.
So we've carried forward, I think, a great heritage. I think the medical school has done a wonderful job with the choices they have made with deans and faculty. And I feel very confident in how it's moving forward, both in the medical school and in the university.
I think that if the school continues to remain true to fulfilling our needs as the people of the state define, we're going to have a very bright future.
More than 50 years into its MD program, the UND School of Medicine and Health Sciences is only getting started.